you are leaving home, and therefore they can come into your home and do all the kind of things that they do. It is specifically coated with powder paint to avoid peeling off. It weighs over 60 kg for a single door. It comes in single, large, 1.5, and double doors. Now, you can also order for special height doors, depending on the height of your door frame. Now, their doors are made of galvanized steel, so it is rust-free. And Woodylocks keys are coded with, with 5 keys per door, which cannot be duplicated. No matter what the person does, they cannot ever duplicate the door. Now, the key actually. Now, if you want peace of mind, security at home, offices, banks, and warehouses, come straight to Woodylocks to have that specialized door that will give you that safety and protection you're looking for. Now, you can find them at Kwama of the Daban-Sokoban Road, or you can place a call to them, or better just send them a WhatsApp message to 050-8777-755 or 0575-777-755. Woodylocks, we protect what matters to you. And I'm sure that what matters most to you is your life. And then your properties will then, come in. Now, given the current economic conditions, it is critical to protect oneself from, financial consequences of any unforeseen events. So listen, I want to encourage you to join the over 8 million customers who are living life the Ayo way. Subscribe to Ayo Recharge with Care annual cover now and receive, 6,000 Ghana cedis in life insurance cover for yourself and a family member to support funeral expenses. You also get to receive 120 Ghana cedis daily hospital cash benefit to support hospital admission bills and 10% no claim cash back. Make life simple. Dial star 928 star 101 hash to sign up to Ayo Recharge with Care annual cover now. Now, to learn more, all you need to do is to get in touch with them. Send them a WhatsApp message to 059-691-8235, or you can visit their Facebook and Instagram pages at Ayo Ghana. Ayo, because you care. Now, do you feel a bit under the weather? Do you feel tired? Do you think that you're exhausted? Now, day in and night, we hustle and we grind to turn all our dreams into reality. Whether we're working hard, whether we're working out or studying in school, or maybe starting a business, there is no place to go but to keep going up, to improve upon what you're doing. But there are times in our day-to-day activity that our energy runs low. That is why you will be excited to hear about Lucozade and what it can do for you, because Lucozade has got you covered. Now you can get the right energy boost to keep you going. Lucozade with glucose will restore your energy during your everyday routine. So wake up your vim with Lucozade. Do so every day and restore your energy. And this advert is FDA approved, so you don't have to worry about anything at all. Let's talk about what inspires many people, including myself. And in the beginning, children in her community, they used to walk to school. By the time they get to school, they're either tired and cannot concentrate on what they're being taught, or they're sweating all over. Today, not only are bamboo bicycles making it easier for these children to get to school, Benes Dapa also employs many women as well. Now, at APSA, this is what we call Africanacity. It is a distinct ability of the Ghanaian to always get things done. Africanacity is our inspiration. It defines who we are and what we do. Now, it's our commitment to helping people find a way to get things done. To find out more, please kindly visit apsa.com.gh and you get all the necessary information that you're looking for right there to aid you. Well, there's good news for small to medium-scale business owners. Now, with SME Plus, you get to manage all your operational cost in communication. This service simply allows you to choose from affordable packages and enjoy talk time, SMS data, and business content all bundled into one subscription. Now, the other exciting news is you get free on-net calls every Monday, that is between 7 a.m. to 7 p.m. Simply dial star 5060 hash to sign up today, or send a WhatsApp message or place a call to 0244-308-111 for more information, and stay connected wherever you are. That's MTN everywhere you go. It's now some 17 minutes to hit 8 o'clock, and to our main conversation for the morning. See, Ghana's National Health Insurance Scheme was created by the National Health Insurance Act of August 2003. It was one of the very few attempts by a sub-Saharan African country to implement a national level universal health insurance program. So it's been 20 years so far. So 20 years down the line, has it been able to provide a financial access to quality health care for everyone? How robust is the National Health Insurance Scheme as we speak this morning? Do you have a card? Have you registered? Do you have a card? Do you use your card? And if you do, when you go to the health facility, are you able to use it comfortably? Now, we chat on The Voice. In fact, it was on my Joy Online last week thereabout, where the health minister, Kwadwo Dwomoh himself, is saying that he does not use the health insurance card anymore. He says he doesn't use it. You want to know why? Take a listen to him.
challenges. From the end user point of view, it looks like health insurance is not working in our country at the moment. I'm a patient and I know what it is. And I interact with a lot of people, not only my constituency, not only my region, but elsewhere. And the complaints that are coming about how those who are subscribed to health insurance are treated in almost all our facilities. To the extent that even CS, some are paying more than 1,000 cedis from their pockets in quite a number of our facilities now, when that is on the health insurance benefit package list. And it's a sad thing. Those of us like you can afford. So health insurance was not done because of us. I mean, those of us, the middle class. But the very poor people. But the poor woman in that village down there. It's a very sad situation. A plea is that, yes, health insurance delays payments, but of late they are paying small. Let me use that phrase. It's small. So why should I use that harsh word? Extort from the poor patients. You understand what catastrophic expenditures are? So we need strategies, not from the DG alone, not from anybody in the ministry headquarters, but how we can get cheaper implants to supply for people to use so that they get out of these challenges. So we need your help. Help in terms of how we can make access cheaper.
So that was the health minister there who says, well, he himself does not even use the health insurance card anymore simply because of extortion that is going on. Now, the NHIS was launched on the 18th of March 2004 by Kufuor with a seed money of 40.6 billion from the HIPIC, fund. I have the regional, manager or regional director for the National Health Insurance Scheme with me in the studios of Love 99.5. His name is Kwadwo Dwomoh. And he's right here with us. Now, as somebody who has the National Health Insurance card, the health minister himself is saying that he doesn't use it. What's your own story? Do you use the health insurance card? And is it able to give you the kind of health care need that you seek when you go to the health facility? Kwadwo, good morning.
Good morning, Dave.
How are you doing?
I'm good, Dave.
Good to have you on the show. All right, so roughly 19, 20 years on, how's the health insurance doing?
Before I answer your questions, I would like to send my deepest and warmest good morning to your cherished listeners. To my Director of Operation for the Middle Belt, Mr. Kwadwo Dwomoh, to the staff at the NHIS office in Ashanti region and the district offices, I say good morning and then kudos to your hard work. Dave, health insurance is really doing well.
Really doing well.
Yes. Even though there are a few challenges, like you said about the
health minister.
I mean, it's just an expression of frustration. Obviously, there are some people who go to the facilities, and there are unscrupulous people at some of our health facilities who extort money from our members. So there's no denying the fact that sometimes when they go, they charge them some money.
But if you say if something is doing really well, and yet you say you have a few challenges, and you relate it to what the health minister is saying, can you really say it's doing really well?
It's doing really well in the sense that, I mean, this is backed by data and figures. As at the end of year 2022, for Ashanti region alone, we had registered for about 53% of the population in Ashanti. So if you just proceed to whether or not health insurance is doing well or not doing well, the figures speaks for itself. And I can tell you that for the first quarter of this year, if you compare the figures as at the first quarter of 2022 and 2023, we have increased by 9.3%.
Increase in terms of registration.
In terms of registration.
Getting people on board the scheme, and those people who are on board the scheme benefiting from the service are two different things.
I would like you to take a casual visit to our health facilities. When health insurance was a matter of choice, now it has become a natural choice. Because when you go to a facility, for instance, the first thing they ask you is, do you have a health insurance card? And I can tell you, David, that for every 10 people that you meet at a facility, 8 of them have a national health insurance.
Every 10?
Every 10 people.
8 have.
8 have. So a system that is not doing well, now we are in our 20th year. So health insurance has survived for 20 good years.
So if a listener out there, I cannot be at every health facility to bring out all the challenges that might be associated with the usage of the card, that is the health insurance card. As you listen to us this morning, when was the last time you used the health insurance card? What challenges did you have, or how smooth was its usage for you? Join us on our WhatsApp number, 05511119995. Record voice messages and tell us how strong, how robust, how efficient, it is for you in using the health insurance card. Our WhatsApp number again is 05511119995. All right. If you have concerns, let's hear them so we can respond to them. If everything is well, again, tell us about it, so at least we can applaud them and say they've done a good job. You can also join us later when we activate the phone lines, but as I speak, we're live on Facebook on LUV 99.5 FM. Join us on Facebook with your thoughts as well. So, you mentioned that there are a few challenges. What are those challenges?
I mean, you are well aware, which has been re-echoed by the health minister.
Are those the only challenges that exist?
I can tell you, and then we also have abuse. Abuse on the part of our members, okay? So that to the extent that when they go to a facility, they are offered a service, they don't really wait to take their medication, they move to another facility, okay, creating a whole lot of inconvenience for us in terms of financial drain of our coffers. And then secondly...
No, expatiate a bit more on that. So you're saying that somebody goes to a health facility, doesn't wait to be given the medication and moves to another facility? That's
what I'm trying to say. They move to a facility. They go to a facility to seek health care.
So they go to a particular hospital?
A hospital. And then? They have given a medication.
Prescription
for a period. They don't wait to go through all the course, and they move to another facility for health care. And that is abuse.
Okay.
Because that's got its own financial implications.
Puts burden and stress.
And then, yes, on the coffers of the health insurance. And then secondly, we also have, there are some times that we are not able to pay our providers as detected by the law.
We'll go back to that shortly. So let's dwell a little bit more on the concerns and the complaints raised by the health minister, Akuetteh Dwomoh. Now, I know that there are people who, for example, will talk about co-payments. When they want to seek health care and they have the health insurance cards, they're told about co-payment. And then he talks about, extortion. You mentioned extortion yourself. Are they the same things, or they are two different things?
They are two different things.
So tell us about the co-payment system, and then tell us about the extortions that are going on.
Okay. So for the co-payment system, sometimes you go to a facility and then you are prescribed some medications. And then some of them will tell you that if you go to the market, the prices as agreed upon by the health insurance are different. So you need to top up.
When you go to the market in terms of medications.
So for instance, if paracetamol says, let's say, 2 cedis, they are saying that health insurance is giving them 1 cedi, so you have to top up, which is illegal. And then for the extortion, these are blatant taking money from people when they are not supposed to be taking money at all.
So why are they extorting money then? If you're saying that, and I heard the minister say that at least they are paying small. So if the monies are being paid, why the extortion?
The extortion, definitely, it is very hard to really answer your questions, because these are human behavioral problems. Okay, extortions are everywhere that you go, because sometimes some of the staff, they take money without even, it doesn't go into the management coffers at the blind side of the employers. So basically, that is.
Have you looked into it?
Oh yes.
What did you find? What sanctions did you apply?
Thank you. Health insurance is a forth-going institution that listens to the concerns of its members, and it is on the heels of this that a national co-payment committee was formed, which has been cascaded down. So we have a regional co-payment committee and a district co-payment committee. And obviously we can act on official complaints. These are not guts or what do you say, armchair speculations and casting innuendos and insinuations. If you report, and I can tell you that for the first quarter of this year, we have been able to resolve 13 complaints, official complaints. When I say resolution, sometimes we move into the facility, collect the monies from them, caution them, and we have rules and regulations that guides this. And if it continues, the facility will be discredential.
You take the license from them.
Exactly. And if it gets to a point that you need to be prosecuted, we've done that before. So
how long do you say we're giving them a long rope? If the person is doing an illegality, and here you tell me, for example, you've resolved about 13 of them. You tell me that, we caution them, we take back the money from them. Is that what the law stipulates? No, for how long would the person commit that offense, that illegal act, before you say we're punishing them?
David, there are magnitudes of offenses, even in the law courts, and there are rules of engagement with our providers. You understand? So, for instance, if you go to a community where we have only one facility there, and unfortunately, our member went to the facility and they have taken some money from the facility. Do you think that, this is common sense, discredential that only facility at the village? What happens to the rest of our members? So there are rules of engagement. First step, a second step, and then the next step.
Those ones that you mentioned, the rules that you use because you don't want to close them or take away the license and all that. Do you think that the rules that you apply are deterrent enough?
They are deterrent enough, and we have had engagement with them. And sometimes it's not the facility. Sometimes there are staff of the facility who does this. So, what is the crime of the management of a facility when a staff in his own corner or her own corner collect money from our members and you discredential the facility to affect the community?
When they extort these monies, do they still bill it to the health insurance?
Sometimes. So do you know what you do? When they take the money, for instance, if it's a co-payment, they ask them to top up, and they take the money, and we're able to refund the money. We also go into their best to look into it, whether or not they bill the health insurance. Okay, in some instances they do, and when they do, we also deduct that money from for the bills that we need to be paid to them.
So you talk about prosecution and all that. At what stage, at what point do you say, okay, fine, this time around we're going to prosecute this facility?
It depends on the magnitude of the fraud.
Give me an example.
For instance, if a facility charges a whole lot of money from clients, and if you look at the bills, and then they present spurious claims where the monies involved are so huge, then the law court will determine whether or not what they did was right or wrong. Which we have done that in Central Region.
In Central Region?
Yes.
What was this?
That was about 2 or 3 years ago.
You also mentioned that some of the concerns that these service providers touch on has to do with the fact that, for example, they are paid. Let me use paracetamol. So when it comes to the health insurance will pay 1 cedi for a paracetamol to them, to the facility. Well, you know that the dollar is not that stable, so prices keep going up, and you will give them 1 cedi for a paracetamol. It goes against them. That is how come they'll talk about the top-ups and the co-payments and all that. Have you reviewed, the tariffs for these health providers, so that they will not be doing these co-payments, because they also want to stay in business, and if what you're giving them is not enough, then they'll find ways and means of surviving in terms of the business that they're in.
So, I think when I was here last year, I made mention of a flat rate of increment of about 30%.
30%, yes.
Yes. Like I told you, health insurance will not survive without the support of our cherished healthcare providers. So we cannot keep them out of business. If we keep them out of business, health insurance will be out of business. So, and then after 30%, it has to also be reviewed again. So, for instance,
after the 30% is reviewed again. So
with their support. So what's
the new percentage?
I am unable to tell you now, but I can tell you that for instance, the figures speaks for itself. Before the revision of the medicines and service list, we were paying averagely between 100 to 120 million claims a month. Ghana cedis a month. Now, after the revision, we are paying 150 to 200 million series of claims every month. So that shows you how committed the health insurance authority.
We're paying every month?
Yes.
We're paying to service providers?
Exactly.
Are you therefore saying to me that there are no backlogs, you don't owe service providers?
No, we pay. When we say we pay, there are technicalities. When we say we pay every month, it's in relation to some months of bills that we've submitted. Okay? When we say we pay every month, we can't pay every month for every bill, because as we speak now, there are some of our members who are at the facility.
So when you say you pay every month, what do you mean by that?
What we pay for every month, we give money to health providers in relation to
previous claims that they
exactly.
Okay, so per the law, and correct me if I'm wrong, per the law, it should not exceed 6 months.
Yes.
That's what the law stipulates. Yes. When was the last time you paid service providers?
We've paid claims for up to September last year.
September last year.
So
we are in what, May now?
Yes.
Isn't that beyond the 6 months stipulated?
Okay. Now, so let me explain.
Please do.
It takes 3 months for a claim to be processed and paid. Okay. So deduct 3 months from the 7 months. So technically, we are owing them 3 months, admittedly, which is basically financial constraints. But I can tell you that health insurance is in the process of paying.
When you say financial constraints, what do you mean?
Oh, but David, there has always been a financing gap in the health insurance. I mean, look at the amount of money that people pay for a year. 26 cedis a year for new members, even for new members, which is less than $2. Okay, so obviously we will have some financial gaps, which is another conversation for another time. So obviously we owe our providers, but I want to use this platform to let them know that we are committed at letting them stay in the business. Because David, where would I be? I'll be out of business if our providers decide that they are not going to be offering service to our clients. And you are in the media space. When was the last time you heard that our providers are going on strike because we are not paying them? It means for every month we try to pay some of our claims. And we are committed at doing that.
So the minister himself says he's not using his card anymore because of the extortion. He says it's a harsh word, but uses it anyway. What has been done about it so that extortion will stop? He's lamenting. I should be lamenting. He should be fixing the problem. You should be fixing the problem. Why are you lamenting? What has been done? What is going to be done, actually?
I did not listen to the entire tape, but he was situating this within the context of what we are doing to solve this problem. So in my initial submission, I told you that we form a national co-payment committee, a regional and a district committee, where if you have a problem, you go to a facility and you are being charged illegally, you will report to us and we will deal with it. But I must be quick to point this thing out. Sometimes there are no illegal charges. Sometimes. If you go to a health insurance cover 95% of our diseases in Ghana. There are certain branded drugs that the health insurance do not cover.
It does not, yeah.
However, sometimes our providers are not able to explain to our subscribers who go to seek medical health care. So when they go and they are charged money, which are even legal, they turn around to tell people that I've been extorted some money. If you look into
because that medication is not covered by the health insurance.
Okay, so instead of them explaining to them, so it's not all instances that they are charged some money that are not supposed to be charged, but they boss it with people who have also been taking some money which are illegal.
When was the last time we did some work on improving the drug list? Because when the health insurance began, it was fine. Then it got to a stage where people were like, the medicines that were being given, substandard. They're not the very best medicines and stuff like that. When was the last time we worked on the drug list?
Just last year, revision of the drug list. We review it every now and then. And I can tell you, the health insurance, the Ghana health insurance, is the most generous health insurance you can ever find in this whole wide world. Germany started over 200 years ago, but for Germany there is co-payment. We pay, but we know our environment. A lot of people do not have money. So our drug list is really, really generous. But there are outliners, okay? The drugs that you will take and you'll be fine. There are some few people who will not be fine. So that is where they are supposed to pay for those drugs.
Let's take a look at some of the conditions that the health insurance covers. I know that it got a stage where breast cancer got on board. Is it childhood cancer? Last year, I think we mentioned childhood cancer was also part of it. I asked questions about whether prostate cancer is there on it. I asked whether mental health is also covered by the health insurance. What can you say about that?
For prostate cancer, discussions are still ongoing.
Since last year when we talked,
there are
still discussions.
Yeah, David, you were talking about financial flow and all of that. You have to hasten with caution. Okay, as we add on, because we are added. Children are vulnerable, and women. You look at the economic empowerment of women in our country. I mean, it's nothing to write home about. So we have to be careful when we seem to be adding on some other diseases every now and then. But I know that with the passage of time, prostate will be added.
Prostate will be. What about the mental health?
Mental health. We have some drugs that are covered by the health insurance. So we are going slowly. Yes.
All right. So, listeners, what we can do now is that we have another interview coming up your way. So we want to activate the phone lines now to hear from you. If you want to praise the health insurance for doing a good job, all well and good. If you have concerns, you have issues that you think you'd like to bring to the attention of the regional director for the health insurance scheme, also do that right now. Give us a call on 03220-83596, 03220-83597, 03220-83598. You can call us now and engage with Kwadwo Dwomoh, and he'll give you all the answers that you're looking for. Kofi, good morning.
Good morning, Brony. How are you?
Well, Kwadwo is listening to you.
Yes. Dave, what you are doing this morning, you are giving us, the listeners, information as to what to ask and why, what to ask and what not to ask when you get to the facility. And I want to commend you for that. But your resource person, your guest, it seems he was not prepared before he came to the studio, because you asked him, you said you have increased the prices for the facilities by 30%. Now you have increased it again. Tell us the percentage. You say, I don't know. Why don't you know? You should know, because we want the information. Because when we get to the facilities and they are, charging us wrongly, we can prove to them that this is what we have heard from the director of health insurance, Ashanti region. If you are not able to tell us, how can we challenge the facilities? So sometimes I want to, if I don't know whether to advise him or not, next time when he is coming on radio to give us information, you should be very prepared, because we are anxiously wanting to hear something so that we can, fight for our rights.
Kofi, thank you very much for joining us. Any response, Kwadwo, to Kofi?
I think Kofi is passionate about the health insurance.
We all are.
Yeah.
We all are. So give us a call on 03220-83596, 03220-83597, 03220-83598. We're talking to the regional director for the National Health Insurance Scheme for the Ashanti region. So I said regional director, so it's the same thing. Hi, good morning.
Good morning.
Yes, boss. What's your name, sir?
Please, my name is Prince.
Good to have you. Let's hear you, sir.
I want to know whether the insurance office, whether at the moment they have offices in all districts.
Okay. So before you answer this question,
the reason why I'm asking that is that where I work, we need data on subscribers, and it's difficult getting it for the district I work in because they are situated in the adjoining district.
So let's go straight to the point. Which of the districts are you in?
Okay, so I'm in Dwabin now. And then when you want to know the number of people living within Dwabin municipality who are subscribing to the insurance office, you can't get the data because it's merged up with the JUSO. And it makes it very difficult for us to plan for the people within our municipality. So I want to know whether by their establishment they are supposed to be in all districts.
All right, so thank you very much, Prince. We'll address your issue for you. But Kofi came in earlier. He was asking why you couldn't answer the question. After the 30% increase, you said there's another increase. He wants to know the percentage.
Yeah, tell Kofi to pipe down. I know Kofi is very, very emotional about the health insurance. We are doing well. We'll put out the figures when it has supposed to be put out.
No, but we want to know if there's been an increase. You can find out and then share with us, and then we'll share with us.
This will come from a higher authority. because listen, it's a major milestone that needs to be announced very well. Like we did with the 30%.
Prince also talks about whether you are in every district. He says, what he said. He wants data. He has to come to a JUSO and all that. What do you want to say to him?
We are at a JUSO Dwabin, so he can go to the JUSO office. A JUSO and Dwabin, they are very close. So we are at the health insurance operate on a different platform. Okay, we have 26 districts by the health insurance arrangement. So for a JUSO Dwabin, that's why we call it a JUSO Dwabin Municipal Health Insurance Office. So you can go to the JUSO office for the data that you need.
Okay. And you can also call us. Our number is 03220-83596, 03220-83597, 03220-83598. Nana Kweku, good morning and welcome.
Good morning. How are you doing?
Well, I'm well.
Okay. Much as we all have this national health insurance, and just the minister said, I will also advocate. More or less, the average people or well-to-do in society do have the card, but at least, just as he said, he doesn't use it. Because he made mention from the instant that you played, he said, well, he has it, and it's meant for people that cannot afford. I also advocate that, look, we can have it. Let's leave it, let's do a contribution, and then leave it for the people that cannot afford to have access to it, so that at least the burden on the national health insurance will be limited to at least people that cannot afford. But you made mention of something. The minister, when he was complaining that there's extortion going on, made mention that he should be solving it. You see, I always advocate. Let's advocate and then advise Ghanaians to stop, be free, and those stealing everything that we engage ourselves in. Because we tend to blame politicians, and people down there are the ones doing the rotten thing. They go up and stealing. He said that, look, it's going to stack everyone found culpable. Probably the national health insurance, we are not going to find anyone there.
I hear you, and we thank you, Nana Kweku. I'm told Prince is back. Prince, very quickly, why are you back?
Yes, David, please. You know, I know they are in Joso. I said it. But I'm saying that the data they collect is linked to Joso Dwomoh. So you can't get data for just Dwomoh subscribers. You know, we plan within a defined area. So I'm working with Dwomoh Municipal Assembly. And so when we want information on number of people living within Dwomoh who are subscribed to the insurance system, we can't get it.
And I get your point. So how does it get data for Dwomoh alone?
Oh, okay. I now understand. Please, we will help you. It's noted. We'll help you. I'll see. I'll have a discussion with the Joso manager and see how we can help. Prince.
So, Prince, call back and leave your telephone number so we can engage with you. So that when he gives us the information, or when he is leaving, we'll give him your number so he addresses it for you directly. Eric is also on the line right now. Hi, Eric. Good morning.
Good morning, Dave.
Let's hear you, sir.
Yeah. I called to just put before you that I'm a driver. I have my license. I'm married, but Dave, had it not been because of my kid, I would have just joined my ancestors and have my free of mind. But it's because of the kid. I have a license, but no work to do. Please, if there is any car that you can assist me, I wish I could, because it's not easy for me.
I hear you. Thank you very much, Eric. And Prince, if you're listening, send your details to this number, 0544 009616. Prince, it's for Prince. Send some information, all that you're looking for. Send that issues to 0544 009616. Nana Ankuma Yabo is also on the line. Nana, good morning.
Good morning.
Welcome, Nana.
Yeah, fine. Okay, my child, a 9-year-old child, was sick and was sent to the ENT department of Tunsu Agogo Hospital. Now, she was diagnosed as having been infected by a disease they call sinusitis, affecting the nose and then some other parts within the nostrils and so on. The officers there prescribed some medications and said some of them are not covered by the National Health Insurance Scheme. And if I show you the X-ray, you'll be marveled, you'll be startled. And it's a child, 9-year-old child. I know whether it is true that some of the medications are not. Actually, I don't have the list of the names with me now. Whether some of the medications are not covered by health insurance, or the treatment of that particular disease is not covered by national health insurance.
Nana Ankoma Yabua, and yes. I pray that your daughter gets better. I hope that even by now she's far better, as we speak. But what's your answer to him? He wants to know whether some of the medications does not fall under the health insurance, especially the condition he mentioned, sinusitis.
Oh, yes. Sinusitis is covered by the health insurance, the disease itself. But for the medication, I cannot speak to it because I don't actually know which medicines was prescribed. Okay?
But sinusitis is covered. But the medications are also covered?
Yes, medications are covered, but I don't know the kind of medicine that he was prescribed, so I can't speak to it.
So it could be that if somebody has a particular condition.
Yes.
It falls under the health insurance.
Yes.
But depending on the severity of it, the health insurance medication will not cover it?
It's not really about the severity, but the person's metabolism. There are certain medications that cannot work on some patients.
Even when I spoke to a certain doctor,
yes,
I spoke to a certain doctor this morning, and he mentioned to me on the phone line that, for example, the health minister talked about CS, cesarean session.
Yes.
It's covered by the health insurance, all right.
Yeah.
But under some circumstances, if there are complications, then you'll be asked to do a top-up. Is that allowed?
He was talking about complications.
So is that allowed?
David,
I want to compare this one from Nana Nkrumah Yeboah, where the child was given medication, but he has to go buy.
Yes.
So I'm asking because under some circumstances, would somebody have to make a top-up? Like the doctor told me about a CS.
It's not just let me answer you very well.
Please do.
It's not necessarily about a top-up. There are certain situations that you need to even buy the medicine altogether, which is not illegal. Do you get me? There are certain medications that are outside the health insurance benefit package, even though the disease is covered by the health insurance, which you need to buy. So for Nana Nkrumah's issue, I'm unable to speak to it because I don't know the type of medicines that was prescribed for the daughter. However, I can use this platform to encourage Nana to send the prescription to our office at the Asukwa district office for us to know whether or not the medications are covered by the health insurance or not.
So we have several more people. I mean, the registration fee is what, 26 Ghana cedis?
26 for adults. For children below the age of 18, they pay only 8 cedis for a year.
And yet, with the 26 Ghana cedis for adults, there are many people who cannot afford it.
Yes.
What is being done by the health insurance to help such people?
Thank you very much. For last year, for instance, the Ashanti Regional Office launched what we call the project 1000K for Kids. That is where we appeal to the moral conscience of our well-meaning Ghanaians in society, especially in the Ashanti region, to pay for children under 18. And really, David, I never knew Ashanti region people are very generous. We had a lot of people coming in to pay. For this year, I want to launch another one for adults who cannot pay. But the health insurance policy itself.
Adults or children?
Adults. We did for children.
So this is for adults?
Which is ongoing. So we want to introduce this one to help adults who cannot pay. However, by the architecture of the health insurance, if you are very vulnerable, regardless of your age status, and you cannot pay, you go to social welfare, they assess you, they tell us that you are an indigent, and we register you for free. You don't pay anything. However, you know, Ghanaians, everybody says they are poor. Everybody says the people, you ask them, what is your telephone number? They are giving you 2 numbers. They have 2 phones, you know. But paying for your health is something that we encourage everybody to do. You're laughing, David.
I see. Yeah. I see. So that's what you're doing this year. When are you intending to roll this out?
We intend to launch it before the end of this month. We call it the Keepers Project, where people who have money, we are launching it at the church and the mosque, so that congregants who have money can pay for their fellow members in the church. I mean, it's godly. It's godly.
Then again, last year I knew one of the things you wanted to do, but before 26 Ghana cedis is very, very cheap to many people. Has that conversation come up to increase it?
Well,
or will you support an increase of the 26 too? Because if you look across, there are people who are doing better than others. So can we find a way and say, okay, some who are doing better can pay more than others to pay the 26 or something?
That is how the health insurance is supposed. It's a social solidarity kind of a thing. It's like that, David. If you have money, you have to pay to cater for people who do not have money. I mean, it's a conversation for another day. It's still on the front burner for a discussion. But personally, this is my personal opinion. I wish it could be increased. That's my personal opinion.
What? From 26 to?
No, I cannot give you a ceiling. But however, the 26 for me, it's
26 are still a month.
That is where, David, you have to join the Keepers Project to pay for your church members.
And you too.
Absolutely, David.
Well, thank you very much, Kwadwo. We have to clear some other things because, like I said, we have an interview coming up as well. So thank you very much for your time. We wish you well, and let's hope and pray that we'll pay the service providers on time, so that they will not do this top up and the co-payment and extortions and all that. So thank you very much,
David. Thank you very much. But before I leave, I'd like to encourage our members that we now have the office on your phone, my NHIS app. If you download it on iOS or Android, you can register with your Ghana card. It's at home, so there's no excuse. Disease doesn't tell you when it's coming. And for David, I'm encouraging you. Please, the Keepers Project will be launched.
So if you look there, someone says, I'm going to pay for 10 people.
Oh.
And the person says, when you are ready, he'll pay for 10 people.
Thank you.
When are you going to be ready?
It will be ready.
You said to teacher, he's on record. He says, David, drop the can and put their will. So I will pay for 10 people when you are ready. So thank you very much for dropping the can and making it will.
Wow.
He's going to pay for 10 people. So when do you want him to come and do this?
Oh, but those are hoping from here.
Even now.
Even now.
Continue to say.
Even now.
Continue to say.
So thank you, listeners. Please, those are open. If you have complaints, we are there to support you. Health insurance is forthcoming, and it has come to stay. 20 years you have been with us, and I know that we are going to survive for the next 100 years. Thank you very much.
That, and not just surviving, but do much more.
Exactly.
Than you do right now. One of the things you did last year that pleased me was when you introduced the free registration for the 70 years and above.
Exactly.
When they register, they don't have to wait for a whole month before they access health.
Yes.
I hope that is still working.
It's still working. It's a policy that has come to stay.
Okay. So kindly note this, listeners, that no employee or representative of the National Lottery Authority (NLA) or any of its affiliates, including licensed digital gaming platforms like Kid Ghana Limited, will at any point ask for payment of any kind for any service or services rendered to their customers. Now, all valued patrons are entreated to beware of an increase in fraudulent activities that seek to defraud in the name of the NLA or Kid Ghana Limited. Now, for all 590 mobile game related complaints and inquiries, kindly call the official Kid NLA customer service line 059 692 1590 or visit the official Facebook page at Kid NLA Mobile. Now, the NLA has also evolved and put in place measures to make playing lottery even more convenient and secure for you. Dial *959# or visit 590mobile.com.gh now to play on your phone across all networks. Now, all wins are paid directly to your mobile money account. 590 Mobile. Now, are you playing it safe out there? Play it safe for your own sake. And this is a message from the Ghana AIDS Commission that says condomless sex is risky sex, and so therefore, if it's not in, it's definitely, if it's not on, it's definitely not in. This is so because our health centers across the country continue to record new HIV infections. The 2021 HIV and AIDS estimates show that 16,938 new infections were recorded in that year alone. This presupposes that people engage in risky behaviors, including having unprotected sex and abusing and injecting drugs. Sex may be fun, but HIV is not. Getting HIV from a few minutes, of pleasure is not worth it at all. Be smart. Wear a condom every time you want to have sex. It will protect you from sexually transmitted infections, including HIV. Now, if you inject drugs, please do not share your injecting equipment with anyone else. This message is brought to you by the Ghana AIDS Commission. Ghana AIDS Commission working actively and in partnership towards elimination of HIV and AIDS in Ghana. Let's talk about how you can preserve water. And so I want to tell you about the Syntex tanks. Now, Syntex is a market leader in water tanks in Ghana, with sizes ranging from 100 liters up to 25,000 liters. You are sure to have the size you need for your business or your home. It's available in many different colors at no extra cost. You want yellow, blue, red? It's available for you. Syntex has just launched a new Syntex Pure Gallon tank, still the strength of a Syntex tank with an affordable price. Get yours today from Syntex agents nationwide. Now, did you know that Syntex doesn't just do tanks? Syntex is your one-stop shop for all your plastic packaging needs. Call them now, 050-5555-666 to find out more, or you can send them a message on their social media handles at Syntex Ghana. Syntex, tough. Indeed, it is tough. Now, sometimes you look at you standing and you ask yourself, now, no fear bridge by it, no cotton bridge, and bridge no cotton, and the skin on effect because he's using the right, lotions and oils. Listen, if you're looking for a moisturizing powerhouse to give you that smooth, supple, and radiant skin you deserve, look no further than vitamin E. With its ability to prevent formation of stretch marks, dark spots, and softens your skin, Evercare Vitamin E is the ultimate skincare solution. And for the very best results, try the Evercare Vitamin E oils. You'll be glad you did.